Mr. Femi Gbajabiamila, Speaker of House of Representatives of Nigeria, has warned against playing politics with the coronavirus vaccines as Nigeria commences vaccination. Gbajabiamila gave the warning in Abuja at the national flag-off ceremony for COVID-19 vaccination.
We must not play politics with vaccine. We must not play politics with the health of our neighbor. This is a time for us to rally behind the government, because like the SGF said, the virus knows no creed, knows no religion, knows no ethnicity, knows no sex, knows no age. So it is time for all of us to come together as a country, because as I've often said, we're actually in a war, but in a war with an unseen enemy. And therefore, when a country goes to war, you go as one. So I want to implore the journalists, I want to implore Nigerians out there, not to give in to conspiracy theories.
Chairman of the Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, Boss Mustafa, flagged off the exercise on behalf of President Muhammadu Buhari. He said the ceremony was the beginning of a well-detailed vaccination plan to reach every eligible Nigerian at the appropriate time.
The vaccines will be arriving in batches, and I urge all Nigerians to be patient with relevant agencies of the federal government and subnational entities managing the deployment process. This is a novel rollout, just like the virus was a novel virus. Let me state categorically that vaccines are very sensitive, life-saving commodity, and the only authorized source is the federal government that has signed indemnity with the manufacturers.
In his speech, the Minister of Health, Dr. Osage Hanire, expressed joy that Nigerians would join others in the global community to be vaccinated against the dreaded COVID-19 virus.
For us in the health sector, it is a relief and the marking of the start of a tedious but hopeful exercise. The vaccination campaign we kick off today will be in 4 phases and will align with the planned arrival of vaccines in batches. Each phase targets a specific segment of our eligible population to ensure equity in the vaccine deployment. The defined frontline healthcare workers are prioritized globally for vaccinations against COVID-19 due to their higher exposure to the risk of infection with COVID-19 in the course of duty.
The WHO country representative said that the pandemic still had a long way to run. According to him, vaccines will be a critical new tool in the battle against COVID-19.
We are really happy to have this additional tool, the vaccine, which will help us accelerate the end of the acute phase of this pandemic. But let me take the opportunity to remind all of us that it will not be vaccine alone. Until everybody is covered, we will still continue. We will need to observe public health and social measures. We need to deny this vaccine the opportunity to further multiply and mutate to create variants of concern. WHO, together with the other UN agencies and partners, we are here to support that effort until such time that COVID-19 will be history of the past.
Similarly, the Executive Director, National Primary Healthcare Development Agency, said it was a momentous occasion for the vaccination of frontline medical personnel in the fight against COVID-19.
On behalf of the team at the National Primary Healthcare Development Agency and the partnership, it gives us great pleasure that we're witnessing what is, without a shadow of doubt, a watershed moment in our lives. Today, we're going to be administering the first dose of the AstraZeneca vaccine to a frontline health worker.